AM 1060 WMEL. Sunday, October 23rd, meet us at Market Street in Viera for the Black and White Brunch and Art Auction, benefiting Helping Seniors of Brevard County. There's an exquisite brunch, a silent auction including Oriental rugs, fine art, sports, and space memorabilia, and our live auction featuring paintings and jewelry, and our beautiful Win the Jaguar 1992 XJS. All proceeds supporting Helping Seniors of Brevard. Call 473-7770 for information or visit helpingseniorsofbrevard.org. Stay in touch with WMEL by going online at 1060WMEL.com. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. That's right, it's me. It's recorded. It's not a recording. It's a live voice. I'm back. I just want to remind everybody that the purpose of our show is to inform, educate, and connect seniors and those that care for seniors to the resources they need to help themselves, help each other, and most important of all, to do the very best job they can to access the resources that will help them age with dignity. And it's not easy to do, folks. I think a lot of you know that I've been out for several weeks, and today Kay is here in the studio with me. Let's put it this way, I'm with her. I wanted her to host the show. She asked me to do the lead-in. I decided I would do that, but before I turn it over to Kay, I just want to say Dr. Sheldon will be joining us, and we'll talk a little about dentistry. We'll talk about a little bit about the black and white brunch, and we'll talk a little bit about the Jaguar. But I want to tell you something on a personal level, and I think it's extremely important that you all pay very, very close attention. A couple of things have come up. One, I've learned the hard way in my 82 years that medicines can tear the living thunder out of you if you don't know what you are taking them for, or if you go off of them too quickly, or if you have an interaction with a medication, it can be extremely painful. I've been on the, most of you have been following me over the years know I've had fibromyalgia for years, but I've been able to contain most of the pain and everything with it through the use of medications and exercise. But you reached a point where you can't do some of the things that you do when you're younger, and they decided to take me off of one of the medications. Folks, it has been almost 3 months now since I am still trying to get off of the effects of this medication that I was on. I'm not going to mention the drug's name, but every symptom we've been able to find on the internet that other people have experienced in the course of going off the drug, I have experienced this phenomenon myself. And I'll tell you, I did a couple articles in the paper about it, and you can go online on our website, helpingseniorsofbrevard.org, and you can pick up a lot more information. But I caution you, if you are going to be taking medications or going off of medications, do a little research yourself, and just don't be a blind taker or getter offer of a medication. Do a little research yourself and ask some questions. I just really would like for you to do that, because it has not been easy, and I've never had a problem going off of a medication, but this time I did. So with that thought, Kay, why don't you go ahead and mention our sponsors. I'll join in a little bit with you today as you do the show.
Okay, well, thank you, and welcome back, Joe
Well,
Steckler.
I also want to say Kay's done a fine job of picking up and doing this show. Of course, she's got experience in doing this. She's been involved with TV work, radio work, and media work. So it's no new experience for you, Kay. But along with everything else you've done, is about being the information sponsor, specialist at the office, helping people. And you'll ask me once in a while if you haven't had a call on something before. You ask me sometimes, and I think between the two of us, we pretty much answer everybody's questions.
We do, Joe Steckler. And I'm just so happy to see you back in person here
Well, it's good
today.
to feel back.
Yes.
I could feel bad, but when I get on this darn mic, John, I always feel better.
Oh, so then you need to be back here every week.
Okay.
Well, thank you, Joe. It's
Maybe
always
we should
been a
put
pleasure.
Joe on every day.
Yes.
What did you say?
I said, Joe, maybe we should put you on every day.
Yeah. For you to feel better every day. There we
You
go.
talked about that a long time ago, John Harper.
Yeah. That's a
Okay.
good idea, John.
Okay, you go ahead and get him off the air. You go ahead and talk what you're going to talk about.
Okay, well, first of all, I want to say a special thank you to our partners here who make this show possible. And I'm going to go through partial of the list here in the first portion, starting with Aldea Today, Barbara McIntyre, who specializes in reverse mortgages, Barefoot Bay Tatler, Brevard Chiropractic and Injury Center, and Neurogenics Nerve Center of Rockledge, Canadian Meds of Melbourne, Cobblestone Real Estate, which is the Waters, Courtney and Braswell Financial Group, Ebony News Today, Ear Care, Handy Pro of the Space Coast. This gal will do modifications to make your home safe. Hometown News, In-Home Personal Services. Now this gal, Carla Pickerel, will help you get organized in your home, whether it be paperwork or just plain stuff that you need to go through. And if you need to downsize, she's there to help you as well. Kindred at Home, Levin Home Care Nurse Registry, Organized Creative Designs, which I just mentioned, Carla Pickerel, Riverview Senior Resort, Senior Scene Magazine. And we'll pick up with the rest of our partners here in our second half of the program. But if I'm not mistaken, do we have Dr. Lee Sheldon on the telephone yet?
There might be somebody of that name here, Kay. Hi, Joe.
Hi, Lee.
It is so good to hear your voice.
Yeah, it's good to hear you too. But I'm always leery and careful of what you're going to say. I've got to be careful what I ask you, so I'll let Kay ask, and then so I keep myself out of trouble.
That's the reason you showed up. You had no idea what I was going to say, and you wanted to cut me off in the past just in case I said something wrong.
Well, Lee, you know, you're a dentist, a periodontist, but actually it's been since 1993 when I first came on your television show that you and I have talked about nutrition, the value of good nutrition, the value of taking care of your body, and not just the mouth, but the effect of everything. And you have followed me closely with my battle with fibromyalgia and offered some very helpful suggestions. And I think that the point here, Lee, is that you're a doctor, and you're just not a doctor of the mouth. You're a doctor of the whole body, and you care about your patients. And I think there are not too many doctors, dentists, or whatever you want to call them, give out their cell phone number to their patients, which you do, because you do that in case somebody has a problem. Am I correct?
You're absolutely correct.
That's still important.
And I have to add to that, because I just typed Dr. Sheldon's article in for the November issue, and he writes about his staff member Danielle, and how even just walking into his office makes a tremendous impression, because she is a high-tone lady. Am I right, Dr. Sheldon?
She absolutely is a high-toned lady.
Yeah, and how does that...
She's becoming a very famous lady. She is being featured in a program for a national program for dental specialists, which will be held in January. And next September, she and I are going to Boston, and she's going to be speaking as well, and I will be speaking as well. We'll both be speaking to the national meeting of the American Academy of Periodontology. So she and I will be doing a program together. So Danielle, who started off as a surgical assistant, is becoming quite a famous periodontal consultant.
Fantastic. Well, and I think everyone will agree that certainly a lot of people have a fear of going into a dentist, or maybe they've neglected seeing a dentist for a number of years, but the first impression is so vitally important. And, to ease the fear, to just set an atmosphere that people are going to feel comfortable and welcome.
It's true. Kate, if you don't mind, let me go back to a little bit of what Joe said, because I want to amplify that a little bit.
Sure.
Because we've talked about that problem, and Joe remember that. We talked about that on the air, about medication withdrawal. And, patients are prescribed, and doctors prescribe medications with all good intentions. Because they're trying to help somebody with an injury or some kind of a problem. And there's some medications that you can get off very quickly, and there's some medications that you cannot. And unfortunately, we as doctors, and I'm including dentists in that group, are taught everything about how to put a patient on a medication, but we're taught very little, if nothing, about how to take a patient off a medication. And so we start to go with others' experiences. And try to help our patients as well as we can. But if you look at the number of doctors who are at the FDA who are there to approve medications, there's far more doctors to approve medications than those that will recall medications or take care of problems with removing medications. So it is incumbent upon you to learn everything you can about your medication, and we have the internet now, and the internet is a double-edged sword. The internet will give lots of good information, and it'll give lots of horrible information. And sometimes there's ways in which we need to decipher and find out where the good information is. So if you go to WebMD, for example, WebMD is run by pharmaceutical companies, but it does give a reasonable amount of good information. If you want to know where doctors go in order to be able to learn about anything in medicine, the website that doctors go to is PubMed, PubMed.com, PubMed.com, PubMed. And in PubMed.com, that hooks us up directly with the National Library of Medicine. It's free of charge. It may be a little bit difficult to read, but you can type in, for example, your medication and see what studies have been done. And you'll get abstracts on each of those medications, or you get abstracts on each of the articles that have been written. And while some of it is a little bit difficult to read, it's not that difficult to read. And it'll give you the objective research that's been done, that's been published in all of the medical journals, and frankly all the dental journals as well. And it gives you a real good idea as to where the studies are and what studies have been done. And it can give you a lot of objective information as to any problem you have, whether it's periodontal disease, whether it's heart disease, or whether it's a particular medication you're on. It will give you some information and lead you to be able to do the research yourself, and you can share that research with the doctor. You can print it out, and the doctor would only be too happy, at least I hope that doctor would be only too happy, to go over some of that with you so that you're so that you are assured that you're doing the right thing. And frankly, I got to tell you, we don't know everything. We try to do a good job. And we study and we go to courses and we read, but we don't know everything. And there have been some times, I hate to admit it, that I've actually learned something from a patient.
Well, Lee, when you followed me as I've gone through with, and I've asked you questions about medications because I know you do a lot of research. And when I told you that I had found a Pharm D, and perhaps you can explain to people what a Pharm D is, but this Pharm D happened to be a young woman that went to school over the Holy Name of Jesus, and then she graduated from University of Florida, I think it was, and then she became a pharmacist, but with a specialty in what we call Pharm D.
Yeah, Pharm D goes to school longer and actually is getting a doctorate in pharmacy.
Wow.
It's the highest degree.
Yeah, well, so what I did, and that's why it's so important for people to understand, I was very leery of all the medications I was taking. So another good friend that knew this young lady said, Joe, why don't you call her, since you know her so well, and see if she'll run a check on all your medications. And she worked for Auburn University, and in one of their medical programs. And I sent her every medication that a list of all my meds and the symptoms and stuff that I've gone on, and the drugs I went off of and the symptoms and everything. And she came back 2 days later and she said that she finds nothing incompatible with what I'm taking. In other words, the medications that the doctors have prescribed for me, there's nothing that seems to be conflicting with anything else with what they're trying to treat me for. So that made me feel better. But what even made me feel better was that my primary care doctor, when I told him, he was appreciative of the fact that I had done that, because he tries to work with me and try to make sure that he just doesn't give me a medication. He tries to make sure it's what's needed for the problem. And I know a lot of us take too much medication, and that's something else that we need to really think about. And that's why I get concerned when I hear people tell stories about going off medication without talking to a doctor. And that's extremely bad, is it not, Dr. Sheldon?
It is, and particularly when you're getting into some of those drugs that involve pain or sensation or psychotropic or something that is working on mood. All of those medications are more difficult to get off of than the traditional medications, like, for example, those you would use for cholesterol or blood pressure, that type of thing.
Yep.
And so when you're using those particular medications, and there may be others as well, you have to be really careful, and you have to look really carefully at what you're doing. And some people withdraw from drugs at a quicker rate than others. There was a book, and I'm sure I'm not sure. There may be other books of their kind, but not that you were on this kind of a drug. You weren't. But I'm giving this as an example. There's a book written by a psychiatrist at Harvard. At least he's a part-time psychiatrist at Harvard. I think he had a private practice, but he wrote a book called The Antidepressant Solution. And it follows the experiences of 4 different patients getting off of antidepressants, tracing them with the type of symptoms they had with withdrawal. And as a matter of fact, there was some confusion there among the patients, because they thought that because they were having withdrawal symptoms, that in fact they might still need the drug. They said, I've still got whatever it is they were being treated for, when in fact it was the withdrawal symptoms all the time. Well, this doctor at least had enough experience to know that he was prescribing the medications, that he had to be able to help those patients taper off them. And he describes experiences of 4 different patients, one of whom I think got off this kind of medication within weeks, and another one who took a year to get off the medication, cutting off a small portion of the tablet each day or each week or each 2 weeks until he or she finally got off the medication. Yeah. So that can be pretty reassuring, particularly when you're going through withdrawal symptoms, because at least you know you're not the only one, that other people have been doing it too, and there is no standard way of getting off it. There may be one that works for most people, but you're not necessarily out of bounds if it takes one longer to get off the drugs. And so that means that you might have to take the medication for a longer period of time, cutting the dose a little bit more gradually in order to be able to get off that drug.
Yeah. Well, so much research, Lee, goes into the medication itself and cause and effect relationship of the drug and curing a problem, but very, very little is done about the withdrawal aspects of the drug. Am I correct?
You're absolutely right, and that's what we've discovered over the years, because I outside the field of dentistry as well. And yeah, that was one of the significant discoveries. And I don't know if it had to do with that particular. I know what drug you were on, and the particular drug that you were on maybe fell into that category. I don't know. Did the PharmD say anything about that as far as speed of withdrawal? Was there any conclusion?
The PharmD said that that the symptoms as I expressed were the same as she saw with other patients coming off. All the files correspond. My wife Terry did a lot of research on this, and almost everything that other patients had experienced, I experienced it at one thing at one time or the other. And the first time I noticed the effects of this drug, when I was getting ready to tape a TV show back in on 16 August, I was 10 minutes into the show and I said, I don't feel right. I ended up in the emergency room that day, and that was the start of it. And I tell you, all you women that have gone through a pregnancy, I have to empathize, sympathize with you, because the nausea I experience has been told to me is exactly what you ladies go through with in having a child. And men, it is not. It is not fun at all. And I'll tell you, to be nauseated for 3 months I have to check with my wife and some other women to find out if that's a record or not. But Katie, you want to join us? Lee and I are having a good time here.
I hear you. Actually, that's pretty normal, to tell you the truth.
It is? That long?
Yeah, but I want to remind our listeners who we're speaking with by the phone here today, this is Dr. Lee Sheldon, who's a periodontist who has more knowledge than you can shake a stick at. And quite frankly, I think he's a clown on the side, but it's always a pleasure to speak to you.
I think there are a lot of people who would agree with you, Kay.
And I also want to give our listening audience our telephone number for helping seniors of Brevard, and that is area code 321-473-7770. If we're on the other line, by all means, leave a message, because we're backed up on 3 different computers, and we promise we'll always return your calls. So we're here to help. My official title is information specialist, and sometimes I think I wear a little bit different hats depending upon what we're doing. For example, today on the radio, but nonetheless, I always enjoy speaking to Dr. Sheldon, who's a pleasure and has, like I said, he's got immense amount of knowledge in what he does, and to me, he's a gem. He's a very special individual, so I welcome anyone to give his office a call. Dr. Sheldon, would you like to give our listening audience your telephone number?
Sure, it's 259-8000, 259-8000. For people out of the area, that's area code 321. 259-8000. And by the way, if you call the office, you can get a copy of our book, The Ultimate Mouth Manual.
Yes, thank you.
Which happens to have a chapter on getting off of medications.
There we go.
There, it's good. It's really a dental book, but I do have that chapter in there as well.
All right.
We got to take a break. We'll be back. Stay with us. We'll be back on the other side, and we will talk about tooth restoration.
Like us on Facebook at facebook.com/AM1060 WMEL.
This is Joe Steckler, folks. Back live with the second half of Helping Seniors. The purpose of the show is to inform, educate, and connect seniors and those that care for seniors to resources. John Harper came in and told me during the break that a couple of our listeners had called in and asked me if I would tell the name of the drug that I was on. I'd be happy to tell you that. And let me tell you first why, sort of set the stage as quickly as I can. I have fibromyalgia. I've had a heart dissection, so I have to be very careful about my blood pressure and everything that I do. And I was having a big problem with water retention, and the water retention started after I started taking a drug called Lyrica. And it's all over the news. There's this all kind of stuff going on about it. And I had picked up about 30 pounds of weight. It was water weight. And the problem here, folks, is that the doctor recognizes this, but then they have to put you on water pills and diuretics to get rid of the water. That in turn is hard on your kidneys, and that means you have to have your blood checked more. And in the process of doing all this, I had command of a couple of submarines when I was on active duty as a submarine officer, and I mentioned this on one of my Facebook tweets, and I had a call from a wife of one of my chief petty officers, and she said that their daughter had gained 70 pounds in water weight, and she too had been taking this drug called Lyrica. So they took her off the Lyrica, and she started losing the water weight, and that was the drug, Lyrica. And but there are many other drugs. So what you need to do is be very careful and talk to your doctor about all your body changes. If you notice a puffiness or a swelling in a certain part of the body that you haven't had before, generally speaking, it's caused by something. Your job is to help that doctor figure out what it is that's causing a problem. My doctor happens to be very appreciative of the fact that I talk to him. And that's it. So that was the drug. And if anybody has any other questions, you can call me at the station, or call Kay at the office. If you want to talk about it, I call 473-7770. She'll give me your phone number, and I'll call you if you want to ask me any questions personally about it, but after the show. But I do want to mention before I turn it back over to Kay that we're going to have this black and white brunch hosted by Market Street over on Morrell Road. It's a new memory care outfit. It's going to be on the 23rd of October, and we've got some beautiful Persian rugs that they are Persian rugs. I got them myself, so I know what they are. They're very, very beautiful, and we have some gorgeous art. We have a set of Indian arrowheads that they date anywhere from 1080 back to 8000 BC. And the reason I know this is because my brother dug them up in Kentucky, and I've been out there with him finding these things. So I know that they're genuine, they're real. We've got that. We've got some quartz from Australia. We've got a Fritz von Eden piece. We hope to have a cacao. We'll have several other things that are extremely nice, some stuff by local artists, and the rugs. And most important, folks, it's your chance to have a free brunch meal. There's no charge, but we hope that those that come will make a donation to help us continue our work, because we charge nothing for our services, and we've helped over 1,200 people, some multiple times over the last 2.5 years, 2 years. And if you need help and don't know where to go and where to get it, it's extremely difficult. Kay called me 2 days ago and said that you remember the vet that had his foot amputated, that he couldn't get the ramp put into his house. And I said, I remember, Kay.
It was a mobile home.
Yeah, it was a vet, and we made a phone call and got him a ramp in 3 days. But another vet had a problem with storm damage and was refusing help, and he called Kay to see if Kay had an idea on how we might be able to get this guy to accept some help. And I haven't had a chance to talk to her about that, but I'll talk to her about it after the show. But there are just so many things that go wrong that you can actually find a solution or some kind of help for it if you just know where to go to get the right kind of help. And that's why helping seniors is so doggone important. I've been involved with senior care since 1993 here in Broward County, folks, and I'm going to tell you, I wouldn't tell you if Helping Seniors was not a good organization if it wasn't. And if you want to make any kind of a pitch to help us keep our doors open, you know, I'm not ashamed to admit that it takes money, and getting the county, United Way, and other organizations to give us money is almost impossible. Not near impossible, it's worse than impossible. But it's going to be up to the people, you people, me people, we people, to make this thing work. So, want to make a contribution, call Kay at the office.
Yeah, the need is so desperate. You wouldn't believe the kind of calls that I get from listening in on the callers that are extremely desperate. As recent as yesterday, I had a lady, her total income was $575 a month. and she was looking for a place to live. She was living with her sister, but her daughter moved back in, and now she said she's gonna be out on the street. So I gave her some suggestions, but I said, at least here's some shelters for you. You're not gonna be on the street. And by the way, that fellow that you were talking about, Joe Steckler, with the amputated foot and so forth, that original call came in December 2014. So that shows you how people remember how we've helped them through a personal crisis and get the appropriate resources needed. So that's extremely important to note.
Yeah, I just can't emphasize enough, Kay, the importance of keeping this program working, keeping it in effect. There are other nonprofits that purport to be helping seniors. Yes, they help seniors, but they have budgets of millions of dollars, and we have a budget of a little over $100,000, and it's quite a bit of difference. And
but we're making a big difference.
We're making a big difference.
That's the bottom line.
That's the thing.
We're making.
You still there, Lee?
I'm still here, Joe.
Okay, look. We're going to talk about tooth restoration.
And, yes, we are.
Yeah, we'll give you a little bit of time here because
you know the ones I come on the program we never talk about what we're supposed to talk about anyway.
Right.
The listeners are used to that. I'm used to it.
Lee, I know there's such things as people break teeth, they crack teeth, we get old and a tooth will shear off. What are some of the criteria that you use for whether or not you can repair a cracked tooth, or how do you help people maintain their mouth in the best condition that you possibly can at a price that the ones that need certain kind of help can, if they can't afford something else, what can you do to help them help themselves?
Well, I think the biggest difficulty here, and we've talked about it before, is diagnosis. A cracked tooth is not always easy to diagnose. I'll give you an example. In fact, I just saw a patient this morning. And the patient came in to me. She knew that she had a problem, and she had some discomfort in the tooth, and so she got a root canal done, which essentially removed the nerve from the tooth, but she still had discomfort in the tooth. Now, the discomfort changed because the nerve was removed, but it wasn't completely gone, and she's still uncomfortable, and she was avoiding that side. What was the problem? The problem was the tooth is likely cracked. And so when you're looking at a tooth, or at least when we're looking at a tooth as dentists, we're looking to see not the obvious crack, because the one that you talked about, Joe, is the obvious crack. It shears off. We decide we can treat it or we can't and extract it and replace it with an implant or a bridge. But then there's the one where there's a small crack, and it goes all the way down the length of the root, or at least part way down the length of the root, below the gum line, in the area where there are nerves that are attached to the outside of the root. And it's very difficult to tell the difference between the nerve on the inside of the root, which is what a root canal treats, and the nerve on the outside of the root, which is where there's a ligament that holds the tooth to the bone. But it's critical that we do at least come up with our best case scenario before we start investing in treatment that may not work. So, for example, if the tooth goes well below the gum line, if the crack goes well below the gum line, then it may not be worth investing in the root canal because, in fact, the root canal won't repair the crack. The root canal just takes the nerve out of the tooth. So it's important that we do the diagnosis first. And there are ways, simple ways of looking at that. You can actually do it yourself. If you took the end of a toothbrush, and I'm not talking about the toothbrush itself, I'm talking about the handle end. And if you're not certain about a tooth, you put the handle inside your mouth and start to direct it at different parts of the same tooth. In other words, if you're working with a back tooth, for example, there are 4 cusps or 4 elevations on the tooth, and you can put that toothbrush handle on each of those elevations. If you bite down on one of those elevations or one of those cusps and you feel pain, but if you bite down on another cusp on that same tooth and you feel no pain, then chances are you have a cracked tooth. Then it's a matter of deciding whether the tooth can or should be saved or not. If you bite down on the toothbrush handle, and no matter which part of the tooth you're biting on, you still feel pain, well, that means the tooth is likely abscessed or has an infection and would benefit from a root canal. Now, there are more diagnostic things that you can do and a dentist should do, but that gives you a clue on how you can determine whether you yourself have a cracked tooth or not.
But
That help?
Let me ask you a quick question, Lee.
Sure.
If you have a cracked tooth,
Yeah.
and you, can you take the nerve out, and if a person just couldn't do it, it was so down on their luck that they couldn't do anything else, is it possible to remove a nerve and leave a tooth in and still function?
If the crack doesn't go way below the gum line, the answer is yes. If the tooth just shears off and you can see the entire extent of the crack, in fact, it just breaks off, then yeah, you could have a root canal done and not restored, and you could do fine. If you don't have any pain in the tooth, it could break off, and if you don't have the money to restore it, just leave it broken off. It's okay.
Well, when you look at
as long
stuff
as
like
you can see both ends of the crack.
when you look at stuff like that, Lee, when is it necessary to decide whether a person needs surgery to fix it or not?
Well, it depends upon the depth of the crack. If the crack goes just below the gum line, then maybe a small surgical procedure can smooth off that crack so you can save the tooth and the tooth isn't being irritated by the sharp edges of the crack. Sometimes a tooth will break off, and I've had this happen a few times in my career. A tooth breaks off, let's say 2 or 3 or 4 millimeters below the gum line, let's say a quarter of an inch below the gum line or an eighth of an inch below the gum line, and the patient looks really threatening. It looks horrible. The fragment is kind of moving around, and so you have to get the patient numb. You remove the fragment, and then we do nothing for 6 weeks, and we look at it again in 6 weeks, and we have to do nothing to the tooth whatsoever. So sometimes it's just patience, and patience can result in a big cost saving or reward because you may not have to do any treatment at all.
Well, Dr. Sheldon, I want to jump in here if I may. What really causes a cracked tooth to begin with?
Well, there are a few things, Kay. Sometimes teeth are inherently weak.
Okay.
And even without fillings, they're inherently weak, and they
Right.
just split down the middle.
Okay.
In other cases, you have a tooth that has a rather large filling, and so the filling itself is in the middle of the tooth, and then you have the edges of the tooth, which are fairly weak.
Right.
Well, if they're fairly weak, then they may break off, just like anything that would be weak may break off under stress. And then the third thing that really tends to make teeth crack more often than not are the people who grind and clench their teeth. Because now, imagine having a weak tooth,
Right.
and now you're clenching on it all the time.
Right.
And that can make it break. People think, it's because of foods that I eat. Unless you're eating some real hard food, you happen to be biting on a hard pretzel or maybe some kind of foreign object or something like that, usually that's not the reason teeth crack. It may be the final straw, but there are other things that predispose that tooth to cracking, such as what I just described.
Dr.
Hey, wait a minute, Dr. Sheldon.
Yes, sir.
How about telling me and tell our audience why it is that periodontists seem to have a propensity to like hard candy?
Touche.
Yeah. You're a periodontist, and you didn't learn your lesson with your first cracked tooth, and you had to go eat a piece of hard candy and have a second cracked tooth, correct?
Joe, the only reason I did that, and I did that years ago, was to prepare for this radio show.
He got you on that one. Oh my.
But you, all joking aside, you sent a question over, and you said that talking about teeth not being smooth, and that there are particularly imperfections in the root area. And the root area is something that most of us don't know anything about. We've heard root canal, and I've thought about a root canal, you just drill down through the tooth, take the root out, and that's it. But that's not true. That root canal goes all through that tooth, and a good person that really knows how to take a root canal now has to work her way through that tooth. It's like coal mining. Am I correct?
It's true, and I've got a confession to make.
Uh-oh.
We, as a profession, are kind of stupid in the way we've designated parts of teeth. We have made it so confusing for anybody who looks at a tooth that if they hear root canal, they confuse root canal with root. And root canal is only a canal through the middle of the root. In other words, the root itself is embedded in the bone, and it has a hollow tube in the middle of it that has nerves and blood vessels, and that's the root canal. And when that nerve or blood vessel dies and it becomes abscessed, or we get a toothache, then we do a procedure called a root canal. So tell me how confusing we've made it so that nobody would understand what we're doing. Because here we've got a root canal and we've got a procedure called the root canal.
That's pretty
The
confusing.
bottom line here is that when we're working on the inside of the tooth, where those nerves and blood vessels are, where the nerve of the tooth is, if you will, that's where the root canal is. And we take out all of the material, the blood vessels that have now become mummified or they've become rotten, and we just take all of that out and we fill that with a filling material. Now, the part that's rough on the root is the outside of the root where the root joins the bone. And sometimes a rough root can make it very difficult to put a crown on a tooth successfully. Patients are born with rough roots. Well, let's assume that rough root becomes exposed, either due to a crack or due to periodontal disease where we lose some of the bone support for the tooth. Now, the root that used to be embedded in the bone, where it wouldn't make any difference, is now on the outside, and plaque and bacteria and everything can accumulate there. And so we need to be careful to smooth off that tooth so that the body can heal and heal correctly around that area so the crown can be put on successfully and so the crown doesn't hurt afterwards and there's no bleeding afterwards. And so there's a particular procedure the periodontists do in order to be able to make that happen.
Well, you know, Lee, it's just with me, like me doing all this research, well, not me, Terry doing most of the research on this on the internet with my fibromyalgia problem and going off the Lyrica and all this stuff. You mentioned your book, The Ultimate Mouth Manual. Folks, I want to make a plug for the book because Dr. Sheldon has done some hand-drawn schematic drawings of the tooth in the book that are, I want to say they look like a child's art because they're so simplistic, yet they define the tooth structure in a way that the layperson can understand what he's talking about. And this book, The Ultimate Mouth Manual, folks, is a little deceiving because it talks not just about teeth, it talks about nutrition, it talks about drugs, it talks about medication, it talks about so many things that you can do about eating better and to improve your overall health. And having said that, I know that you've got your second version out, Lee. Are you working on a third?
Yeah, I haven't started working on a third, but believe me, that is something that's going to be in the works because with the experiences we're having here now with the three doctors working together, we've got lots of good things that are going on right now. So there will be a third, but nothing started yet.
But what I said is correct, and Lee, about the way you've written this book it's simplistic so that people that read it can understand what it is at the point that you're trying to make.
Yeah, that was my purpose. As a matter of fact, we had two editors. One of them was Eleanor, who knows a little bit about dentistry, and one of them was someone who knows nothing about dentistry. So I wanted people other than dental people reading this and editing it for me so that it would be totally clear.
It's an excellent book. I requested it from his office. And Dr. Sheldon and people, if you can give your telephone number one more time, Dr. Sheldon, so they can call.
It's area code 321-259-8000, 259-8000.
Excellent. All right. Well, I'm so glad to see you back in this studio, Joe Steckler, and it's a real pleasure to have you. So I'm going to let you wrap up the show.
Oh, I'm glad that I came in just to sit in and listen a little bit. So I did give Lee a chance to talk a little bit. Lee, you didn't let Kay talk at all. But folks,
sorry, Kay.
That's all right.
This is the fun part about radio and talk radio. And it's why it's so important that stations like WMEL, AM 1060 continue on the air, because they provide extremely valuable service. And thank you, John, for the hurricane coverage that you provided to everybody. I've heard several comments on that. And I want to thank Kay for filling in, doing the shows.
You bet.
I hope to get back on soon. And thank you, listener, for listening. And if you want to come to the Black and White Brunch, call Kay at 473-77770. Talk to you later. It's been a joy.
Thank you.